Do your legs feel heavy sometimes, making even a short walk feel like a marathon? Do you get woken up by sharp, painful muscle cramps, often in the middle of the night, leaving your legs sore and tender the next day? Maybe you've just noticed your legs don't feel as strong as they used to, making things like climbing stairs or getting up from a chair a bit more challenging than you remember. These feelings of weak legs and those frustrating, painful cramps are incredibly common as we get older, and they can really impact your independence and quality of life. You might dismiss it as just getting older, but what if there's a common, often overlooked reason behind it that you can actually do something about? There's a secret. Or maybe it's more of a widely known but often ignored fact about a specific vitamin deficiency that is a frequent culprit behind these exact symptoms: the weakness, the aches, and those nighttime cramps that steal your sleep. It's something that many of us, especially those over 60, just aren't getting enough of. In this video, we're going to uncover exactly what this vital nutrient is, why you might be deficient, and most importantly, practical, simple ways you can boost your levels to help your legs feel stronger and finally get some relief from those awful cramps. It's easier than you might think to make a real difference. Watch to the end for something that will truly surprise you about how far-reaching the effects of this deficiency can be. So, what is this hidden cause of weak legs and painful cramps that affects so many people, particularly as we age? We're talking about vitamin D. Now, you might immediately think of vitamin D in relation to strong bones. And yes, it is absolutely essential for bone health, helping your body absorb calcium. But its role goes far, far beyond that. Vitamin D is not just crucial for your skeleton. It plays a really significant part in the health and function of your muscles and your nerves. Think of your muscles. They need a complex process involving calcium to contract and relax properly. Vitamin D helps regulate this process by influencing calcium levels within the muscle cells themselves, and also by supporting nerve signals that tell your muscles what to do. When you don't have enough vitamin D, this whole system can falter. Your muscles might not get the signals they need as effectively, and the internal processes that allow them to work smoothly can be disrupted. This disruption can manifest as that feeling of weakness or fatigue in your legs, making everyday activities feel harder. It can also make your muscles more prone to involuntary contractions, leading to those sudden, painful cramps, especially when you're resting or trying to sleep. Imagine trying to walk up a slight incline, and your leg muscles just feel heavy, tired, and unresponsive. That can be a sign. Or picture lying in bed at night, just drifting off, and suddenly a powerful cramp seizes your calf muscle, causing intense pain that leaves you rubbing your leg and wide awake. These aren't just random occurrences. They can be your body's way of signaling that something isn't quite right with your nutrient levels, specifically your vitamin D. Now, why is this deficiency so common in seniors? There are several key reasons. First and foremost is sunlight exposure. Our bodies are designed to make vitamin D when our skin is exposed to sunlight, specifically UVB rays. However, as we get older, several factors reduce this natural production. We might spend less time outdoors due to mobility issues, health conditions, or simply lifestyle changes. When we are outside, we might be more covered up, even when our skin is exposed. The ability of older skin to produce vitamin D from sunlight decreases significantly compared to when we were younger. Think about it, the skin changes as we age, and its efficiency at this process just isn't what it used to be. Another factor is where you live. If you live in a region with long winters, less daylight, or weaker sun angles for much of the year, it's incredibly difficult to get enough vitamin D from the sun, regardless of your age. Add to that things like using sunscreen, which is important for preventing skin cancer, but also blocks UVB rays, and even air pollution can interfere with vitamin D synthesis from sunlight. Then there's the role of the kidneys. Once vitamin D is made in the skin or absorbed from food, it needs to be converted into its active form in the liver and then the kidneys. As we age, kidney function can sometimes decline, which can make this conversion process less efficient. So, even if you're getting some vitamin D into your system, your body might not be able to use it as effectively. Certain medications that are commonly taken by older adults can also interfere with vitamin D absorption or metabolism. Conditions affecting the digestive system can also make it harder for your body to absorb vitamin D from food. So, it's a perfect storm of factors: less production from sunlight, potentially less efficient processing by the body, and sometimes issues with absorption. This is why estimates suggest that a significant percentage of seniors are deficient in vitamin D, often without even realizing it, attributing symptoms like muscle weakness and cramps to other causes. The insidious nature of it is that the symptoms can be subtle at first, just feeling a bit tired, maybe a few more aches than usual. But over time, this can progress to more noticeable muscle weakness, difficulty with balance and mobility, and those undeniable, painful cramps. It's a real and significant issue that can impact your ability to stay active and independent, which we all know is so important for overall well-being and happiness as we get older. Understanding why this deficiency happens is the first crucial step. Knowing that it's a common, explainable issue, rather than just an inevitable part of aging, can be incredibly empowering. It means there are things you can actively do to address it. So, how do we tackle this widespread deficiency and help those legs feel stronger and cramp-free? Let's look at the first simple, practical ways you can start making a difference today. Now that we've talked about why vitamin D deficiency is so common as we get older and how it links directly to those annoying weak legs and painful cramps, let's dive into what you can actually do about it. The good news is that there are several practical, accessible ways to boost your vitamin D levels. The first way, and the most natural one, is through sunlight exposure. Your skin is a marvelous vitamin D factory. When UVB rays from the sun hit your skin, they trigger a process that creates vitamin D. For many years, health advice focused heavily on avoiding the sun, which is important for preventing skin cancer. But it unintentionally contributed to widespread vitamin D deficiency. The key is finding a balance, getting some safe sun exposure without overdoing it or getting sunburned. What does safe sun look like for vitamin D? It doesn't require hours baking in the sun. Even just 10 to 30 minutes of midday sun exposure to your arms, legs, or back, a few times a week during the warmer months when the sun is strong enough, can help your body produce a significant amount of vitamin D. Midday is when the UVB rays are strongest, and thus most effective for vitamin D production. Of course, this varies greatly depending on where you live, the time of year, the weather, and your skin type. People with lighter skin produce vitamin D faster than those with darker skin. If you have darker skin, you'll need longer exposure to produce the same amount of vitamin D. It's important to remember that once your skin turns slightly pink, you've gotten all the vitamin D you're going to make from that session, and further exposure just increases your risk of sunburn and skin damage. So, short, sensible periods are key. And yes, if you're putting on sunscreen with a high SPF like 30 or higher covering all exposed skin, it will block the UVB rays needed for vitamin D production. That's why finding that balance or considering other sources is important, especially if you live somewhere with limited sun, have very sensitive skin, or are advised by your doctor to avoid sun exposure altogether for other health reasons. For many seniors, relying solely on sun exposure might not be realistic or sufficient, especially during certain times of the year or due to lifestyle factors. This brings us to the second way to increase your vitamin D intake through your diet. While it's challenging to get all the vitamin D you need from food alone, especially compared to what your body can make from sun exposure, certain foods are good sources and can definitely contribute to your overall levels. The best natural food sources are fatty fish. Think about delicious options like salmon, mackerel, sardines, and herring. These fish contain vitamin D in their flesh and skin. A serving of salmon, for example, can provide a good portion of a day's recommended intake. Other animal sources include cod liver oil, which is very high in vitamin D, and egg yolks, although you'd need to eat quite a few eggs to get a significant amount from the yolks alone. Beyond natural sources, many foods are now fortified with vitamin D. This is a really important way that many people get their vitamin D. Look for fortified milk, dairy, and non-dairy alternatives. Orange juice, breakfast cereals, and some yogurts and margarines. Checking the nutrition labels is key to seeing if a product is fortified and how much vitamin D it contains per serving. For vegetarians or vegans, finding food sources can be a bit trickier. Some mushrooms, particularly those exposed to UV light, can contain vitamin D2 ergocalciferol, a form that's less potent than the vitamin D3 cholecalciferol produced in our skin and found in animal sources and most supplements. There are also fortified plant-based foods available. Something else to keep in mind when it comes to absorbing vitamin D from food is that it's a fat-soluble vitamin. This means it's best absorbed when consumed with some fat. So, having your fortified milk with a meal that contains a little healthy fat, or eating fatty fish as part of a balanced dinner, can help your body utilize that vitamin D more effectively. It's not about needing a lot of fat, just enough to aid absorption. Also, vitamin D works together with other nutrients. Calcium, as we mentioned, is tied to vitamin D's function. But magnesium is also incredibly important. Magnesium is involved in the activation of vitamin D and plays a direct role in muscle and nerve function, including helping muscles relax, which can help with cramps. So, a diet that includes good sources of magnesium like leafy greens, nuts, seeds, and whole grains can support your body's use of vitamin D and directly benefit your muscles, while sun and diet are foundational. For many seniors, they simply aren't enough to get levels into a healthy range. So, what's the most reliable way to ensure you're getting enough? That's what we'll explore next. Now that we've covered getting vitamin D from sunlight and diet, let's talk about what is often the most practical and effective way for seniors to ensure they have adequate level supplements. Given the challenges many older adults face with getting enough vitamin D from sun exposure and the limitations of dietary sources alone, taking a daily vitamin D supplement is frequently recommended and can make a significant difference. When you're looking at supplements, you'll usually see vitamin D listed as either D2 ergocalciferol or D3 cholecalciferol. For increasing blood levels of vitamin D, vitamin D3 is generally considered more effective at raising and maintaining levels in the body. This is the same form your skin produces in response to sunlight and is found in animal-based foods. Vitamin D2 comes from plant sources like irradiated mushrooms and is used in some fortified foods and supplements. But D3 is typically the preferred choice for supplementation. How much should you take? This is where it gets a bit more personal and where consulting with a healthcare professional becomes really important. General guidelines exist. For example, many health organizations recommend around 600 to 800 international units IU of vitamin D per day for adults, and sometimes higher for seniors, maybe up to 800 or 1000 IU. However, these are just general recommendations to prevent deficiency. If you are already deficient, you will likely need a significantly higher dose, at least initially. To replenish your stores, the best way to know exactly what dose is right for you is to get a simple blood test. This test measures the level of 25-hydroxyvitamin D in your blood, which is the best indicator of your body's vitamin D status. Your doctor can interpret the results and recommend a specific dosage based on whether your levels are sufficient, insufficient, or deficient. And they can also take into account your overall health status, other medications you might be taking, and any conditions you have. Taking supplements is generally very safe, but it is possible to take too much vitamin D, which can lead to toxicity. However, this is quite rare and usually only happens with very high doses taken over a long period, often tens of thousands of IUs daily for months. Symptoms of vitamin D toxicity can include nausea, vomiting, weakness, and confusion. And it can lead to excess calcium in the blood, which can be dangerous. This is another crucial reason to get your levels checked and work with your doctor on the right dosage. Rather than just guessing or taking very high doses without supervision, a typical maintenance dose of 1,000–4,000 IU per day is considered safe for most adults. But again, individual needs vary. Remember how we talked about vitamin D working with other nutrients? Taking a vitamin D supplement is most effective when it's part of an overall healthy approach. Continuing to eat a balanced diet that includes calcium and magnesium is important. Staying physically active also helps your muscles function better and can improve your overall mobility, complementing the effects of correcting a vitamin D deficiency. Even simple things like regular walking or gentle strength exercises can make a big difference in how strong your legs feel. So, we've covered getting vitamin D from the sun safely, from food, and through supplements, which for many seniors is the most reliable way to ensure adequate levels. We've seen how this vital nutrient is directly linked to muscle strength and preventing those painful cramps, particularly in the legs. Correcting a deficiency doesn't just help your bones, it can truly improve your muscle function, reduce weakness, and significantly cut down on the frequency and severity of cramps. It's about empowering your body to work the way it should. It's encouraging to know that addressing those frustrating symptoms like weak legs and nighttime cramps might be as simple as getting your vitamin D levels checked and potentially adding a supplement under medical guidance. It's a relatively easy step that can have a profound impact on how you feel and how much you can enjoy your daily life. Remember, small changes really can make a big difference to your health and happiness, especially as you navigate the later years with vitality. Have you experienced these symptoms of weak legs or muscle cramps? Have you ever had your vitamin D levels checked? Or found that supplements or changes in diet or sun exposure have helped you? Sharing your experiences and what has worked for you can be incredibly helpful and encouraging to others facing similar issues. Please leave a comment below and share your story or ask a question. Let's support each other in this community. If you found this information helpful, if it gave you something new to think about or empowered you with practical steps, please give this video a thumbs up. It helps more people see this important message. And if you haven't already, consider subscribing to the channel so you don't miss out on future videos packed with practical tips and encouraging advice for living your best life at every age. Taking proactive steps like understanding your nutrient needs is key to maintaining your strength, your independence, and your overall well-being. You have the power to make positive changes. Keep moving, keep learning, and keep living your best life at every age.